move on to our prepared speeches. The absence of laughter has stirred great concern among the residents of Monterey. Today we have an expert reporting on this topic, giving his number 3 speech from the Entertainment Speaker Manual entitled CME, the case of Dr. Martin Samuels, is Dr. Fred Sadler. Over to you, Fred.
Number 10?
Time?
Oh, time?
Time?
For your
How much time?
7,
5 to
8.
7.
Oh,
Thank you, Madam Postmaster. I'm speaking from the field. I'm speaking from myself. I have to get organized as to where I'm speaking from. I'm actually going off to San Francisco this weekend to a CME conference. And CME is an acronym for Continuing Medical Education. And it's something that we physicians are required to do by state law. 25 hours a year, which comes out to half an hour a week. You better do more than that.
Yeah.
Madam Toastmaster, fellow Toastmasters and guests. When we go to a lecture, those of us who are generalists, we like to go to a conference typically to learn a broad array of things because we see patients with all kinds of different problems. And we're typically spoken to by a specialist who is an expert in some narrow field. And so we have a series of these talks over, in this case, 2 days. And the specialist typically says something like, my disease is the most important because it affects so many people. It's so common, it's so serious. And there are all these people who die and all these people who suffer. There are great economic consequences. So it's very important that you generalists out there listen to me and learn what I'm saying. Because you, in fact, since this is such a common problem, whether it's hypertension or diabetes, are going to be managing all these problems since we're too busy. In fact, I am off giving lectures, so I can't see these problems. So you better learn everything I'm telling you and know everything I'm telling you so you can do a good job. I'm not going to expatiate on this matter, but I'm going to try to help you out. Now, he has a very tough time because of the next 8 speakers are all going to say that my disease is the most important. And therefore, we sitting there in the lecture hall are going through a series of most importance. And after a while, it becomes a blur. What is the most important in the pantheon of most important? Now, there are studies that have been done on people who are listening to lectures. And they typically say something like this. After about 20 minutes, most students are either falling asleep, they're doodling, or they're having sexual fantasies. Other studies show that after a CME course, maybe a month later, it is rare if one person remembers one pearl from the entire 2 weeks. So it's difficult to pass pearls of wisdom that people will retain. An exception is Dr. Martin Samuels, who is a specialist in neurology. Now, neurology is the specialty that deals with the brain encased in the head. And he and I were residents together in Massachusetts General Hospital about 30 years ago. And he already was a great teacher. But now he is on the lecture circuit. He's a full professor at Harvard and he's chairman of neurology. And he has his inner Toastmaster polished to a high sheen. All his lectures are classic, one of which I'm going to tell you a little about today is about headache. So he started off as usual and said, my organ is the most important. Our diseases are the most important. In fact, I have the only organ in my specialty where you can talk directly to it and have a conversation with it. Well, we all chuckled and laughed, and it was very clear that we were going to have a good time. We might actually listen for more than 20 minutes. He pointed out several things that I can still remember more than 10 years later. One was he asked us in the audience, and there were about 3,000 of us packed into this huge lecture, what do you think is the most common problem that students and residents and doctors have when they deal with a headache patient. And we came up with some esoteric ideas. But he said, that's not it. People forget to examine the head. And we all were aghast, and then chuckled, and then realized, he's right. We typically look at a headache patient. We get all this data. We have CT scan reports and MRI, but do we actually go up and take the patient's head in our hand and examine it? Very rarely. So point number one, pearl number one, when a patient has a headache, examine the head. He had several other points, one of which I still remember, and that is, although a brain tumor is very rare, 99.9% of headaches or greater are not caused by a brain tumor. When you finish up the exam with a patient who has the headache, it's always important, no matter what the diagnosis, to turn to the patient and say, Mrs. Holloway, you don't have a brain tumor. Now, why is that important? Because everybody, consciously or unconsciously, wonders, well, gee, maybe, are they missing something? Maybe I have a brain tumor. He also said, no matter how frustrated you get with a difficult patient, whatever you do, don't ever say, it's all in your head. Because that's why they came to see you. No, it's all in their head. So give them some facts, tell them what's going on, and if you don't know, tell them you don't and send them to somebody else. And fourth, he said, no matter how frustrated and confused you get with a difficult patient, don't tell them you'll just have to live with it. After all, they've been living with it all this time. That's why they came to you. They don't want to live with it anymore. So 10 years later, I can't tell you what my sexual fantasies were during that course. But I can tell you that when a patient comes in to see me with a headache, they need to be examined. They need to have their head examined. And it has to be by me. And whatever their cause is, if they don't have a brain tumor, I need to look at them and tell them, you don't have a brain tumor. And whatever happens, I never tell them, it's all in your head. You've got to live with it. So thank you, Dr. Marty Samuels, and master teachers like you. Madam Toastmaster.